7-site skinfold measurement to obtain body composition. Some key notes before starting. All measurements should be recorded on the right side of the body. Ensure that the skin is clean and lotion-free to prevent slippage. Mark sites before measuring. Calipers should be held in the right hand with the dial facing upward. Caliper reading should be 1 centimeter from the pinch and held for 1 to 2 seconds. Some additional notes. Take measurements in rotational order to allow the skin to settle. Record a minimum of 2 measurements at each site. Readings should be within 2 millimeters of each other. And calculate the average for each measurement. Firstly, to measure the tricep site, measure the distance from the acromion to the olecranon process and mark an X at the halfway point. Then obtain a vertical pinch 1 centimeter above the X and take the reading directly on your marking. Next, to measure the subscapular site, place the subject's arm behind them to easily identify the scapula. After locating the inferior angle of the scapula, measure 2 centimeters below and mark with an X. The subject may now relax the arm for the reading. This is a diagonal fold. Pinch 1 centimeter above the X and obtain your reading directly on the X. For the chest site, measure the distance from the anterior axillary line and the nipple. For women, the X should be 1/3 the distance away from the anterior axillary line. For men, the X should be 1/2 the distance. Obtain a diagonal fold and reading for the chest site. For the mid-axillary reading, slightly move the subject's arm back away from the body. The X should be 1/2 the distance from the anterior axillary line and the iliac crest, level to the xiphoid process of the sternum. Obtain a vertical fold and reading for this site. For the abdominal site, measure an inch or 2 centimeters to the right of the subject's umbilicus and mark with an X. Pinch 1 centimeter above your marking and obtain a reading directly on the X. Next, for the suprailiac reading, ask the subject to point to their iliac and mark your X superior to it. Pinch 1 centimeter diagonally above the marking and obtain your reading directly on the X using a diagonal fold. Lastly, for the thigh, have your subject shift their weight onto the left leg. With the right leg, have them slightly flex the hip and the knee. Measure the distance between the anguinal crease and the patella. Mark your X halfway between these 2 points. Ask the subject to relax the leg and obtain your vertical fold reading. Accuracy from skinfold measurements is plus or minus 3.5%, assuming proper technique and the correct equations are used. Here are some common and general equations for calculating body density for an extensive range of individuals.